When looking at non-surgical therapies for the prevention of hair loss, there are a number of choices out there. It's important to remember there's no cure for hair loss. So using multiple therapies at the same time is often indicated. And as an overview, there are three main tiers or levels of effectiveness when talking about preventive therapy. Let's go through each of these therapies in a little bit of detail. In the top tier of effectiveness, or the level 1 effectiveness, would be the drug finasteride and low-level laser therapy. In the second tier would be platelet-rich plasma therapies, and in the final and third tier would be topical things like Rogaine, Revivagen, any lotion, potion, salve, or ointment that you put on your head would be the least effective. Propecia or finasteride is a drug for men only, and what it does is lower the level of the hormone that causes hair loss. What hair loss really is a genetic sensitivity to a normally occurring hormone called dihydrotestosterone. DHT is made from testosterone, and finasteride is a little molecule that kind of jams up the enzyme or molecular motor that accomplishes that process. When you're taking finasteride, your levels of testosterone will increase by about 10%. Your levels of DHT will decrease by about 60%. This lowering of the DHT that really is so effective in slowing down hair loss. Also in the top tier of effectiveness is low-level laser therapy. This was FDA approved in 2007 for the treatment of men's and women's hair loss. Low-level laser therapy can be performed at home or in our office. It's simply a little cap that you wear 3 times a week for 30 minutes. It comes with a battery pack that's rechargeable. The battery lasts all week. It's not like a cell phone that runs out every day. In the second tier of effectiveness for the prevention of hair loss would include things like platelet-rich plasma treatments and fetal growth protein microneedling treatments. These are non-surgical procedures that are done right here in the office. They take about an hour or so, and it's a nice way to prevent hair loss from a cellular level. In the third and final tier of effectiveness for the prevention of hair loss would be topical therapies. And that would include things like Rogaine and a product called Revivagen. There are many products on the market for the treatment of hair loss that you can simply apply to the scalp. Rogaine or minoxidil is FDA approved for the prevention of hair loss, and you would apply that once a day to the scalp, to the affected areas. It comes in a foam. 5% foam for men is what I most frequently recommend because it's a little bit less irritating to the skin, I believe, than the liquid.